let's get started because I am very excited to be hosting and very nervous to be hosting the first Ask session that I am the host of. So I am Loree Cook-Daniels with Forge, and today we're here with Jeff Whittle from the All of Us program here in the Milwaukee area, and Mahri Bahati, who is with PRIDEnet. And Mahri will start us in a minute and help set the frame. I'm sorry, it will help set the frame for what we'll be talking about today. So today the focus is on, can my health history help solve the COVID crisis? And for those of you that have been here before, which is most of you, the format of the Ask Questions is for people to ask. So be ready to ask your questions here because they're very welcome. We also have a couple of Forge staff members on the line who can help behind the scenes if you have any technical issues. So before we get to your questions and the first presentation, a little housekeeping. Forge and Freighter and the Medical College of Wisconsin, the Inclusion Health Clinic, have partnered to bring you a very full schedule of events and support structures over the next 6 months. This project is funded in part by the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin. We are recording for those who aren't able to be here today. If you end up asking a question that you'd rather we cut out, that is a possibility, let us know. So you can listen or ask questions either way. So is everyone online familiar with Zoom? You can adjust your view. Gallery view means seeing multiple people on the screen. Speaker view, you only see the person speaking. You can also pin any person if you only want to see them. So closed captioning. Michael, can you explain that?
Hey everyone, this is Michael. If you'd like to have closed captioning, you can click on the word closed captioning at the bottom of your screen, and it will give you the option to, what are the options? The option is to show subtitle or to show a transcript. So either view will get you the closed captioning.
Thank you. You can ask questions by raising your hand, and one of our staff will unmute you. Can people find the raising your hand button down at the bottom? Practice it. Okay, great. Most of you got it. Okay, thank you. And then you can ask questions in the chat box. So we'll do that with our opening question. Put into the chat box, please, what is one word that comes to mind when you hear the word research? Fun, okay. Science, heavy. Data, learning. Test tube and grants, hopeful. You can tell who has to write grant proposals. Analysis and skeptical. Okay. So that's and again on research. That's a great start. Okay, I would like to now turn it over to Mahri, who can introduce herself and go ahead with her presentation. Mahri?
Hello, can everybody hear me? You can hear me? Okay. Hi, my name is Mahri Bahati, and I am Community Engagement Specialist at PRIDEnet. And Forge is a community partner with us, and I'll explain more about what that means later, but I'm happy to be here today and to tell you about what we do at PRIDEnet and why we work with All of Us Research Program, and again, also what's coming out of our studies about the coronavirus pandemic. My pronouns are she, her, and hers, and my accent is Southern, in case you're wondering. I live in California, but I'm originally from Kentucky, so, you know, if you have any questions about anything that I say, if I say something, you know, that needs clarification, just let me know. And so I'll get started with a little overview. We'll talk a little bit about what is community engagement, community engaged research, what is PRIDEnet, what is the PRIDE study, which is a study started by us, and then what is the All of Us research program, which is something that started we started working on with the NIH a few years ago. I think we're going into our 4th year working with All of Us research program. We won't have time today to talk about what we've learned from talking to communities around the country, but I'm happy to invite you to join our newsletter and just stay connected to us to learn some of these things, because we're trying to translate all of that knowledge into doing research in a different way. So I'm going to show just a quick, like 2-minute video on community engaged research, and I think it'll help kind of explain what we're doing here and how we are different.
Community engaged research is a collaborative process between the researcher and community member that creates and disseminates knowledge and creative expression with the goal of contributing to the discipline and strengthening the well-being of the community.
Community engaged research identifies the assets of all stakeholders and incorporates them in the design and conduct of the different phases of the research process.
So one reason why I like to show that video is just because it just in a very simple way just explains why we do what we do, and then kind of like can help identify what we do. We just got an email maybe last week from someone who was saying like, this is so weird to see a research study have this huge social media presence, or and I want to know like why you all are doing this, and I'm going to be working on this project, and I want to learn how you're doing it too. So again, if you remember the video, it was saying that community engaged research identifies the assets available in the community and then uses them in the design and the conduct of research. And that is kind of a founding principle of how we work here at PRIDEnet. So as you see here on the slide, how we support the meaningful engagement of LGBTQ people in every step of the research process, because our lived experiences as community members should be assessed and used to do research that is ultimately going to promote health in our communities. And oftentimes people in our community are used to people coming only in the implementation phase. So only when they're giving the survey out to people and standing, on the corner or in the nightclub, or, putting it, a flyer somewhere, come take the survey. That's sometimes the only part that we are familiar with with the research process. Or we may hear in the news that there was some study that shows, this connection with LGBTQ health, or what have you. But the thing that makes community engaged research exciting and potentially more valuable for our communities is that if we are involved in the beginning of the process, from when these questions are asked and when they're designed, or people ask us like, how should we approach the community, we're going to get better results. And ultimately, if you go through to the end of this arrow, you'll see dissemination. Like researchers have a responsibility to also get that information back to us in ways that we can use it to make that change. Because you don't want to say, I took this survey and they asked me all these questions about, my health or my HIV risk or what have you, and then I never saw anything from it. Or I got a $25 gift card, but who knows, my life hasn't changed. So it's, again, a holistic view and a way of using kind of what's available in the community, the knowledge and the assets that are there to really conduct better research. So that's kind of what makes us different, and some of what really motivates us and why we have this network really working on getting LGBTQ people into research is that we know that many LGBTQ people experience mistreatment in clinical settings. And this is one of the things that we already knew, but we went and did listening sessions around the country, and these pictures are from 2 of those listening sessions. And we just heard story after story of how people aren't that motivated to be a part of research. They have health priorities that, you know, supersede that. It's like, I can't even find a doctor um, who will use my pronouns or will like refer to my body parts correctly. So why, you know, that's not my priority to go be a part of research. And, you know, the thing that we're having to try to convince people is that, you know, number one, we are different. We're a different kind of study, we're a different kind of project. And we are, again, doing this in an engaged way with the community to make sure that, you know, we want to participate in it and it's going to be of value to us. Because again, we know that when people have these negative experiences, not only are they not wanting to be a part of research, they're also not getting health care, which is even more crucial to trans people, including myself, given kind of regulations that just have changed with the HHS 1557. Like so many of us are now worried about our health and whether we're going to get adequate health care. So, you know, we're a research project that has all of that in mind, and we use that kind of throughout that whole process that I showed you in the previous slide. So PRIDEnet is a network of LGBTQ serving clinics, community centers, advocacy groups, professional organizations from all around the country. This is a picture of our partner logos, and you can see we have HRC, which is a large national organization, down to the Arkansas Transgender Equality Coalition, which is a very small organization. We have clinics on here, and then we have academic organizations. We want to make sure that they're reciprocal relationships, so that, you know, we're not just saying, can you get people into our study, which happens a lot. Many people in our community are used to that, especially people at organizations. They may have some researchers sweep in and say, hey, get some people to take our survey, and then they get nothing out of it. So we don't want to build relationships like that. We want to make sure that they are beneficial on both ends of that. Most of our study, the PRIDE study, is completely digital, but we do in-person engagement around that, as well as for all of us, which I'll talk about later. But basically, we want to make sure that we're reaching every segment of the community, because we know some people in our community, especially what we've heard from the bisexual plus community, is that some people in our community are only getting digital interactions because they can't be out, or, you know, they may have 2 different Facebook pages, you know, and 2 different sets of social media accounts. And we want to make sure all those people are in our studies. All of those people are able to give input to make our research better and more robust. So, and ultimately, we just want more good research out there about LGBTQ plus health, and that's why we try to build and strengthen these relationships. We have an advisory board. Loree is a member of our advisory board, which we call our participant advisory committee. Of course, we work with community partners. We do events like these, presentations. Before the coronavirus, we would come table at people's events. We do lunch and learn presentations. This is a version of that. And again, we did community listening sessions. We work with ambassadors, and all of these are stipended roles. We have heard from our community that, you know, our expertise is often not well compensated or appreciated, and we are sure that's the value of us to, you know, if we're going to ask you to be on these committees or whatever, that, you know, it's compensated for the work that you do. And so, yeah, we compensate our ambassadors as well. They're more oriented towards community engagement. They do a lot of things out in the community for us, and also help us hone our messaging and stuff like that. And then We have we have a few different social media channels. We have a website, and then we also have a newsletter that you can join and stay in touch with what's coming out of the PRIDE study, and also learn more about the All of Us research program. So again, as I said before, the PRIDE study was started in our team. Actually, PRIDEnet was born out of the PRIDE study, but it was started by Juno Obeden-Maliver and Mitchell Lund when they were medical students at Stanford University. And it was piloted originally as an iPhone app. And once that went really well, and they demonstrated that they could get a lot of people to sign up and take the test, take the survey, sorry. And then they received funding to just really build out this community engagement network and build out this internet platform to be able to conduct the survey. And now I have a short little video to show.
Are we good with the sound? Okay. I'm a Russian-speaking, gay Catholic,
Chinese, Mexican,
Latina,
white male,
biracial,
bisexual,
trans woman, lesbian,
Colombian American.
I kept trying to come out to my parents, but they really don't understand.
I mean, I like being a lesbian.
I don't wish I was straight at all. I think that this makes me special.
And especially in this time and age, being gay is seen as an asset.
You know, the person who really is most accepting of my transgender identity is my mom.
She came at me with a knife and screaming that she would rather see me dead than living the life that I was living.
I knew that there were aspects of who I was and how I was in the world that were not welcomed in the medical world.
When I visit a new doctor, it's always a challenge.
I had colon cancer about 10 years ago.
One of the first things I feel like I have to do is kind of dispense with this notion that I'm straight.
You know, so what are you using for birth control? And I said, nothing.
You don't want to go into a clinic and then end up having to educate your own doctor.
And she just stopped and she looked at me like I'm an idiot.
That's what they're there for. They should already know.
You know, going to the doctor should be a safe place.
I try to avoid situations where I feel like I'm going to be stigmatized or discriminated against, but I know that that is something that I can't always control.
Our community has gone through an enormous number of hard things over many, many years.
You know, thing after thing hits us, and we always come back.
I mean, really the community provides, in many ways, everything.
We really need to join together as the diverse and dynamic communities that we are and help to transform the health system together.
I always feel that if my struggles can help someone else not have to go through the same thing I went through, then it hasn't all been in vain.
Okay, so as you can see, that last little portion said, are you 18 years of older and LGBTQ like us? That's about it for as far as who can take the study. Anybody who identifies as a sexual and or gender minority who is over the age of 18, lives in the US, and for the time being is comfortable reading and writing in English, that makes you eligible to take the PRIDE study. We have about 18,000 people right now, so that side's a little old, but it's a national study when what we're asking is how does being LGBTQ plus affect your physical, mental, and social health? And we're the first study of this kind to really ask this comprehensive set of questions. And because it's that comprehensive, it does take a little bit to complete. When I have done it, it's taken me an hour and a half. Some people say they can get done in 45 minutes, but you take it online once a year. You can make an appointment with yourself, and it'll really contribute to a vast set of knowledge about our community's health. So I do encourage you to join if you want to. If you go to our website, this is really the steps of joining. You answer these eligibility questions, which I just went over in the previous slide. You do your consent. you do your privacy acknowledgement, and then you create an account. And then from there, you know, you'll get reminders and stuff to take the surveys. And I do hope that everyone will take that opportunity. So if you want to know what we're learning, and that's kind of what we're here for a little bit today, we've already had some things published. And if you want to go to pridestudy.org/research, we've had some articles that have been published about eating disorders in our community, some other things about substance abuse, and other things about just like a wide range of topics. And then I think there's an article, even if you want to know about the pilot phase of our project when we were just on the iPhone, there's a published article about that. So there's a wide range of stuff, and more stuff is coming out as we speak. I mean, so many of these articles probably have just come out in the past year to a few months, and now they keep coming out more rapidly. So definitely stay tuned to that page if you want to see what we're learning. Or you can just get our newsletter, and we always put those kind of things in our newsletter and share them on social media. So one thing that we did want to talk about today and kind of bring this back to current events is that we do have a COVID survey that you can take with the PRIDE study, and also questions about respiratory illnesses in general that you can take. And some of them are going to be incorporated into the main annual survey. But we did just publish something. It hasn't even been 10 days, just on June 28th. And I'll put this link in the chat box when I get done with my presentation. But it's really looking at changes in depression and anxiety levels in our community coinciding with this pandemic. We've done activities ourselves. On our social media, we've had online events really to deal with these issues. We had a PRIDEnet cafe about sexual health and maintaining intimacy and sexual health during this age of social distancing. And also, we just recently had a writing workshop for with daily writing exercises on how to, you know, promote healing and well-being kind of in this era, not just of coronavirus, but all the other social things going on right now. And basically, as you can see here, what we learned is that there are many more symptoms of anxiety and depression that have been arising after the pandemic. There's much more to read. Again, I will put these links in there for you to follow up on that, but I just want to point out that the PRIDE study does have the opportunity to kind of tell your health story as it relates to the coronavirus, and we hope that you will take an opportunity to do that, as well as for the All of Us research program, which I'll talk about in just a second. So again, dissemination is very important, and we do try to get all these research results back to the community. People can follow us by the research page that I just spoke about. We also have a blog, we have a newsletter, and then we also send these emails and things out through our partners, and Loree's pretty connected to us. So if you need any information about that, definitely reach out to us. And we're also, you know, our study is available for people to do their own research. So you can apply to use our data as well. So I'm going to move on so we can just do more questions at the end, and I'll just talk about kind of what we do with the All of Us research program, and then turn it over to Jeff. So the All of Us research program is a large national, a federal health study. It's based around precision medicine. I'll talk about that in just a second. And they want to build a database, a health database with the health information of over 1 million people, which already, you know, sounds huge. It's just, I think it's just amazing that a project this huge really started out with our community from the beginning, and has allowed us to really have so much input on how this is conducted, and it's really showing by how many people in our community want to be a part of it. So we do have this page that we created with All of Us. It's really a page for our community. We do update it, and we do kind of take in feedback from the community and to make it better. But you can go to joinallofus.org/LGBT, and that's how you can join if you want to be a part of the project. But I will move into, we have another quick video to show, and then I will explain a little bit more about what it's about.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
When I came out, I didn't feel comfortable, I didn't feel safe, you know, and that was a very hard place to be.
Coming out as lesbian, gay, bisexual, even now transgender, it was hard to do that. And so because of that, you know, whenever you went in to see a doctor, you were too afraid to really actually say who you are.
The biggest obstacle, to be honest with you, and simply is this trust, right? The trust from the community on not being misgendered, not being mistreated.
The health community, healthcare, they didn't get that. At that time, they felt like everything is one fit, that no matter what happens to one community, it's going to happen exactly the same thing to the other community. And that's not the case.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
Oftentimes what happens, particularly within communities that don't feel safe within a medical field, is they'll prolong and they'll wait and they'll say, it'll get better, and then by the time they go to the doctor, it's so late.
My family has had issues like high blood pressure, diabetes, so I'm very mindful of that and really trying to do everything I can to resist that.
One of the things for me that I have to be careful of is, my heart. My mom died at a very young age, at the age of 43, of a heart attack.
What I really appreciate about All of Us is really taking this approach to make it inclusive of as many people as we can.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there is more information to work with when trying to develop new ways of treating people and treating those disease processes.
That's the only way we'll be able to find out and understand whatever that we need to do to take care of ourselves.
That's a call to be honest and open about being LGBT. It's really a much broader call to stand up and be counted. All of us being seen will give us hope.
Okay, so we saw a lot of themes that in that video that we're probably all familiar with. The aspect of trust and standing up and being counted in these federal or research studies. As we've gotten out in the community and done engagement and outreach, people have asked us, like, well, does the federal government really want me in this study? Does Donald Trump want me in this study? Yes, I don't know about Donald Trump, but I know that this program wants they want all of us basically in the project. And so we just really want to stress that we've done so much to make sure that it's a welcoming experience, from providing training to frontline staff on pronouns, on how to welcome you into the space, how to make the space look welcoming, with the right images and pictures. So I definitely want to just deconstruct that image that is out there, that this could maybe not potentially be a bad experience, because we haven't had that experience. And so let me I sidetracked a little bit, I'm sorry. So let me go back to my slides. precision medicine is the basis of all of us. And basically, it's getting the right treatment for the right person at the right time. So if you see here on the slide, in the pictures on the right, you have people with glasses. And we all know, like, if I wore glasses and someone else wore glasses, we couldn't necessarily switch. And the person, both of us will be able to see out of those glasses. And that's kind of the way that medicine is moving in that direction, is to really get people to share all of the information about their lifestyle, their environment, and their biological makeup to really find treatments that work specifically for each of us and using all of these characteristics. So part of how they're doing that is to build these relationships with 1 or million more people, asking people to share their health stories and share their health information, and really accelerate the breakthroughs to kind of get these treatments out into the field and out for us to improve our health. And again, as I spoke about before, this is a totally different approach to diversity. And I think I veered off a little bit because I don't know, I guess because we are talking kind of in a trans context, and myself being trans, it felt a little personal. So I apologize for that. But again, it's just such a different program that is committed to diversity and really reflecting that diversity and actively coming out into our communities and asking us to be a part of it. And so I was just trying to stress that, and I hope that everyone got that point. And we've seen from our community that a larger percentage than anyone expected. At one point, it was over 10% of enrollees identified as either a sexual or gender minority, which is just actually amazing. And it's not a surprise to us, because when we go out in the community, people are like, yes, I want to be a part of research, but we haven't always been reflected in these large national studies. And we just have to keep asking our community to help us change that. So some things that you might have to do to be a part of all of us, the first step would be to go through your consent process and do that online. You can go to joinallofus.org/LGBTQ and join that way. After that, you can take surveys, and you can see kind of what they are there. They're all different modules that you can take. And if you want, you can stop there. You don't have to do all of these steps, and not everyone will be asked to do all the steps, but you can definitely participate at your comfort level. And again, just be counted in this large database. Some of the questions that they hope will come out of the study, and this is not an exhaustive list, this is just an example of a few of the kinds of questions all of us can answer. But again, this is based on the questions that we may want as a community, as SGM or LGBTQ plus people are going to affect. We have to be a part of the study if we want to get our questions answered about our health. So we have to participate and encourage our friends to participate, so that, again, as we talked about before, involving our community in every step of the process, is important. And so this means we have to participate, and then we have to shape the questions that get answered about our health. And so just wanted to stress that. And I'm coming up to the last few slides here. Again, you can just create an account, go through your consent process and start the surveys, and then you may be asked to come in and give more samples. This is available to researchers. I won't get into this because it's a different crowd, but you can go to researchallofus.org and kind of see some data snapshots that are available. And it really is interesting to look at. I mean, you don't have to know a lot to navigate, a lot about health to navigate it. It's really easy to point and click. You can see here, I mean, you can like click on the data snapshots and really get a good idea of what's in there. Just here, you can search a keyword. You could search a medical condition and see who's in there. you can search a certain lab test and see what kind of lab tests they have in there and how many lab results they have. It's really, really, really interesting, and I encourage, if you're just curious about it, you know, we all are curious for different reasons, and we all want to participate in research for different reasons. But if this is interesting to you, definitely take a look at that. And I think this kind of brings me to an end, and I can definitely turn it over to whoever else who's next.
Thank you, Mahri. To try, this is a little confusing, so before I turn it over to Jeff, I'll just see if I can say it a different way that might help. PRIDEnet Pride Study is out of the West Coast. It's totally LGBTQ. They have been contracted with all of us out of DC to provide help with the LGBT portion of all of us. Did I get that right, Mahri?
Am I on mute? I don't know if I muted myself. Yes.
Okay.
Yeah.
So Mahri has given us a little bit about both of the studies, and now I'm going to turn it over to Jeff Whittle, who is working on the All of Us study, specifically in the Milwaukee area. Jeff, do you have some discussion you can give us about what you're doing here locally?
Sure. Yeah. So I don't have slides that I will automatically put up, although I can put some up if you'd like. So the Medical College and UW in Madison and the Marshfield Clinic and then the Gunderson Clinic are 4 places in Wisconsin that are part of the All of Us research program. The way it was organized is there are 10 consortia across the country, and we asked to be one of them. And we were selected in part because Wisconsin does deliver actually a fairly diverse population. Here in the southeast corner, there's some racial and ethnic diversity. We include the Marshfield Clinic and Gunderson Clinic, which serve a rural population, which is oftentimes not included. And Madison has a great deal of experience with participating in large cohort studies, so they also added a skill set that was necessary. And so I think that Wisconsin is in some ways fortunate because we will have a much larger number of people participating in this program than other states will have. One of the reasons that's valuable is that although the first steps, as Mahri described, involve people completing surveys and giving access to electronic health records, in many cases people want the data that's available from that won't be sufficient to answer some of the important questions. So you could imagine somebody studying Alzheimer's disease, how people think, and there's perhaps a genetic marker that they discover in a blood sample that was obtained, saying, oh, well, this cohort of people seem to be associated with Alzheimer's disease. And so somebody would test relatively young folks who haven't had any symptoms of Alzheimer's yet, say, well, maybe we should do some brain imaging on those individuals. Those studies are going to need to be done at the site where the person lives. So there'll be a lot more opportunity for that here in Wisconsin than there would be if you were somebody that lived in Indiana, where there isn't any All of Us site. And so the hope would be that Wisconsin residents and Wisconsin scientists will really participate in a lot of different interesting research activities. Speaking on behalf of the LGBTQ community, I think that is something that makes it important that we have broad representation from that community in Wisconsin. Otherwise, it'll be heavily weighted towards people who have that the things that are unique to the LGBT community, but only in the context of, say, living on one of the coasts. And so it's really important that we get a really diverse representation, not just overall, but actually within our state as well. So we're hopeful that will happen. I think Mahri pointed out that at one time over 10% of the participants classified themselves as LGBTQ+. That number is 8.8% right now. There's another 2.8% who haven't classified themselves in terms of sexual orientation. And then there's a very small fraction of the population that classifies itself as trans, which is an area of particular concern for me. So I think that it's a big opportunity for people in Wisconsin to have an outsized impact. I think that the Medical College, Madison, both have sites here in the Milwaukee area where people can enroll. I'm not going to spend time on logistics of enrollment. Mahri did a good job of presenting the slide that showed how folks enroll. If you have questions about logistics, then you can either email all of us at mcw.edu, or you can call, you can just go online and Google All of Us Wisconsin, and you'll come up with websites that bring you to our website. So I don't want to spend time on that. I think this is a good chance, as Mahri said, for people to ask questions. And I'd love to talk about some of the great things that we could do. And I think people are probably going to have questions about the All of Us research program. I guess I will take time and anticipate just one question that oftentimes goes up in populations that have been historically done ill by the medical establishment, and that's the privacy of your data. So the All of Us research program really takes that in I'd say 3 different ways. So first, it's what I would call standard research practice, and that is as the data is gathered, it is separated almost immediately from the identifying information is separated from the research data. And so that would be name, addresses, specific dates, specific geographic locations, and that's put into a file that's not connected with any of the medical information and is actually not readily accessible to researchers. And so that study ID is what's linked to both of those things. Then the next step is I guess an electronic step or a engineering step, and that is we store the data in different physical locations and in different logical locations behind a very high quality firewall. And then we have professional hackers try to break into our electronic data systems on a regular basis, and so far I'm happy to report that none of them have been able to successfully do that. We've been audited by the Office of the Inspector General, which said, well, you guys should change this and this to make it even more secure. So we really have gone out of our way to make sure that we're using state-of-the-art security systems and they stand up to attempts to get into this system. And then the last barrier is legal. As you know, there are some barriers about using genetic information or health information to discriminate against people, but those don't pass uniformly. What the All of Us research program has is it has a certificate of confidentiality so that people cannot access your data, and actually the research program can't give out data that's connected to personal identifiers. So in particular, in the case of legal issues, if somebody were to come after us and say, well, we need legal information about Jeff Whittle because we understand that he may have had some legal difficulties and the information is health records would be helpful to us, we not only won't give it to them, we can't give it to them. So that kind of legal protection is very important. I think many of you have heard the story of the Golden State Killer, where a person had committed murder and they were unable to solve the crime, and they worked with the commercial ancestry data, the genetic databases like Ancestry.com and 23andMe, and we're actually able to identify, because those programs don't have the same security All of Us does, to identify people who shared genetic information with the person who committed those murders. And so when they went to those folks, they said, you know, one of your relatives appears to have been this murderer. They said, oh, that was probably Uncle Harry. And sure enough, when they went to Uncle Harry, he was the person who'd done that. And you'd say, well, that's not a bad thing. They're capturing murderers using genetic data. But people who have been put upon in the past recognize that that kind of access to data can be used for ill purposes as well. And so really, I think it's very important that all of us can say to you with a great deal of confidence that nobody can link your personal identifiers to the genetic information or the medical records information that you're sharing as part of this research program. So I'll leave it there and then ask if there's other questions that people have.
Okay, this is Loree. As people might be writing questions into the chat, I want to ask Mahri if you can talk a little bit as well about privacy and security for the PRIDEnet study. the PRIDE study?
Yes, yeah, because we had a big question about that at when we just had our national summit, and again, people asked the same question because I think at the point, like sometime in February, there was an article about ICE or some kind of federal agency being able to look into research studies, and we have to like dispel that rumor because they can't access our data. Like I remember, I went back to look at the certificates of confidentiality. I mean, the language is just very strong. It says we cannot be compelled to share data, and so just as Jeff spoke of for all of us, it is the same situation for the PRIDE study. We also have a certificate of confidentiality and cannot be compelled to share this data with anyone.
It's I see a different question that's come up about the use of this data for machine learning, and I think that because all of us does collect biological samples that give access to genetic data, people sort of always focus on genetics, but I think that actually machine learning is another huge area where this will be used, because there'll be an unprecedented level of data, not about just what's in the electronic medical record, but also about health behaviors, about where people live and work. And the All of Us program will link data about where people live and work to exposures and other things that are important in determining health. And so I think for a doctor like me to sort of, when I'm in the office with a patient, to say, oh, well, so you live in this zip code, and you've got this genetic information, and you're from this background, and you used to live in these places, it's just very unreasonable to expect that's going to happen. So I think that by the time I retire, I'm going to be using a computer to process a ton of the data that I see from folks, because it's just not going to be possible to use all the data at once. And that's actually one of the things that's, I think, very important to the medical college and why it's participating, is because we do train a ton of future doctors for Wisconsin. And because we will be kind of on the front lines of determining how to use machine learning in actual clinical practice, I think that we'll really have a great opportunity to learn from the All of Us research program how that's going to happen. Probably not going to happen in 3 years. I think in 3 years, or maybe 5 years, I'm going to be using strictly pharmacogenomics, so knowing what your genes predict about how they respond to different drugs. That will probably happen pretty early. More complex machine learning, where we integrate all that, get different kind of data, might be a few more years, but it will happen, and it will be in part because of the All of Us research program. It's a very good question. Sure. Somebody's asked about the percentage of non-binary, and so I think Mahri had showed the data dashboard, and I will go to the data dashboard and pull it up right now as soon as I get my other computer unlocked. Meanwhile, Mahri maybe can answer one of the other questions.
One thing I will say about the data dashboard is I think that there was an issue, and this is just an example of how one thing that makes me happy about all of us and happy to work with them is the sensitivity that they have around what is publicly available, because I think I don't know if it can get that granular in the data snapshots, and maybe it can, I can't remember, but even we had many calls about whether people should be able to access an information, because we know that what's publicly available people can get and potentially use it to in stigmatizing ways. And the fact, to me, I just appreciated the fact that they came to us, not just us as the LGBTQ plus community, but racial and ethnic minorities, engagement partners, and people over 50 to really ask us to like look at the data browser and look at ways that it could be, this information could be sensitive, and try to balance the needs of having easy access to, or somewhat easy access to the data, but also protecting kind of like what people can come out of it with. So I will say that I just, but I don't, Oh, I don't know if you
Okay.
had an answer.
Yeah. All right. So
Okay.
good. Sure.
I was just
I'll give
rambling
you-
till you got an answer.
Okay. So the people who identified as non-binary at this time, so we're only about a quarter of the way there in terms of enrollment of individuals, but about 0.4% or 820 folk identify themselves as non-binary. 3.3% or about 650 people identify as transgender. There's 98.5% identify as straight, cis man or woman, and then there's a certain fraction that prefer not to answer, and then 1% or 0.1% chose other options. I think so. Mari brought up this idea of, so how is this data available? You say, holy cow, you can look at this right here without even doing a thing in 2 seconds. So I can look at summary data in 2 seconds. There's 3 tiers of data access. So you can go to the place that Mari showed the slide, and it really is the Join All of Us website, data browser. You can go in there and see how much data we have about folks without any permissions at all. But that's just going to give you the summarized data. If you are a researcher, the first level of access is what we've made available now, but is just barely starting, is only now being used. And that gives you access to totally de-identified data, where they make it so that you can find out that there is a person, study ID number 1173263, who identifies in these ways. But you can't find out other things about that person that might allow you to discover who that really is. And so what we do at that level is we obscure dates of events. So somebody can't say, well, I know this person was in this place, so probably that's them. We obscure dates of our locations beyond the first 3 digits of your zip code. So we can tell you're in southeastern Wisconsin, but you can't tell you whether you're in West Bend or Racine. And so it's a fairly broad area that's included at the 3-digit zip code level. And then we can't give other things that would be with other information capable of providing, for example, birthdays. Those are all dithered a little bit. They move the birthday by a little bit in this situation, so that you can't identify folks, even though you can use the general range of somebody's age in studies. So it's the threshold that's used is that a statistician cannot identify who the person was. That's the level of privacy that they ask that you provide at this level. At this level, you have to be somebody who's registered with the NIH. So you're a member of what's called the NIH Commons. So that, as part of it, requires some training in the ethics of research. And you say the researcher, say, I am not going to try to find data about these individuals. So it's again, multiple levels. There's the researcher has been trained in research ethics. They certify they're not going to do something that most people would consider unethical. And then we make it as difficult as possible for somebody to do that. The highest level of data access, where you actually do need, let's say I gave the example of something where you would gather additional data from individuals. At that level, a advisory board to the All of Us research program, which includes community members, then looks at those programs, and not only have they been internally IRB reviewed by the institution that's supporting them, but All of Us has another board that basically is not only this is ethical and it's worth the trouble of the participants involved. So that's something that's a higher level of security. And in that situation, if, let's say, they did need to reach out to an individual, they would say, I need people who are like this. This is the researcher asking the NIH for that. Then the NIH would reach out to people who meet those criteria. And then those individuals might say, well, yeah, I'm interested in research. Tell me more about it. So the NIH would give that person some information about the study. And then at that point, the NIH would say, okay, you're interested. Here's the name of the researcher. You, All of Us participant, can now reach out to the researcher. They won't say, you researcher, here's the name of all of us participants who would be good for your studies. And so it's really the participant who's controlling access. If once you meet the researcher and you say, well, this is really important, I want to be in touch with them, and you want to give out your phone number and your name, then by all means, just as with any other research project, you can consent to do that. But it is really a fairly strong firewall between the participants' privacy and any researcher that might want to look at the data.
Great, thank you. We're nearing the end, but I do have one more question, so maybe you can give a somewhat succinct response, the two of you. The question is about resilience. We often focus on health disparities in research. What kinds of data are being collected that will help show the resilience factors in trans and non-binary communities? Who would like to go first, Mahri?
I'd like to go first, and then I'll just be really brief, and then Jeffrey could go. So one thing I will say, I was at the National Trans Visibility March, and this is more of a story than anything, promoting all of us research program and the PRIDE study, and I'm handing things out to people, and there was an older trans woman sitting on the bench, and she's like, I don't need to be a part of this research. I'm a trans success story. I'm not sick. People, we have to dispel this image that research is for sick people. These are different kinds of studies, both the PRIDE study and the All of Us research program. One way we can find resilience is if people are being a part of it that are succeeding. You know, like you have to share your data in order for us to be able to mine out those resilience factors. So this is research is not just for people who are sick. So I think being a part of it is the first thing you can do to help make sure that there's data there to find these resilience factors. As far as speaking to specific data about resilience factors, I will leave that to Jeffrey. But I just wanted to say that really quick because I just feel like that's one thing we have to dispel, is that these two projects are not just for sick people or not just for well people. They're for everybody, and you can be a part of changing that and helping us get those things.
Great, and I'll endorse that as well. I guess I would say that, so we collect a lot of information about individuals, so we know how things are going forward, and we know where things were when folks started. We gather things about where people live and work, and so it'll be linked to things like, oh, being in green spaces is a resilience factor. So people who spend a lot of time out in the outdoors seem to be doing better. This is something that really is a good strategy for folks who are from this group or that group, or for all groups. Same things as far as diet, same things as far as health behaviors. So I think that there's many opportunities for researchers to identify things that really help people have flourishing lives. So I guess I would leave it at that. There's just a range of things that can be studied. It'll be up to you to push the researchers in your neighborhood to do those studies. So just because the data is there doesn't mean it's going to be used. So I think it's very important that the community remain engaged. And at the national level, the LGBTQ community is very well represented on national oversight boards, and I think the level of interest that they express suggests that they'll continue to be an important driver of the research that's done.
Great, thank you both very much. I appreciate you being here. And I will wrap it up with our usual wrap up, which is to reminders of upcoming events this week. In honor of the fact that we've made it almost to the end of June, which is a big deal these days, we're going to take the Tuesday, June 30th off. On Wednesday, July 1st, we're going to talk about what does the U.S. Supreme Court decision really mean for trans folks. Shelley Gregory will be doing that. On Thursday, July 2nd, we'll have Sparkle Pop Boom, Staying Grounded Amid Fireworks and Festivities with Michael. Friday, July 3rd, we're having Meditation and Grounding with Matthew Lewis. Tuesday, July 7th, will be COVID-19 updates for trans communities with Dr. Petrol. Wednesday, July 8th is a writing workshop with Matthew Lewis. Thursday, July 9th is a scavenger hunt exploring your neighborhood, which is going to be very interesting. Tuesday, July 21st is Trans Plus Advocacy and Activism with both me and Shelley Gregory. And July 23rd is Getting the Touch You Need and Deserve. So that's a little taste test of what's coming in July. I will remind you that Forge has cloth masks that we can send you for free, so contact us if you're interested. And when this session closes, there'll be an evaluation, and these are always very helpful when you fill them out for us. So thank you again, Jeff and Mahri, for being with us today and doing a stellar job of letting us know what research is going on that's involving us. Thank you very much.
Thank you. Thank you for giving us a chance.
Thank you.